Diphtheria by Anouk, Juliet, and Doug. Diphtheria is an acute infectious disease and was first described by Hippocrates in the 5th century BC. It is caused by the bacterium Corynebacterium diphtheriae and has 4 biotypes. Today, it is not a great threat to public health. However, in the 19th and 20th century, it was responsible for a large number of child mortalities. With the introduction of the toxoid vaccine in 1923, incidence of diphtheria declined rapidly, and now there are only 6,000 cases worldwide and only 4 in the Netherlands. Diphtheria spreads through respiratory droplets and by skin lesions or fomites. As humans are the only natural host, it can only be passed from human to human. Symptoms usually start after 2 to 5 days after exposure, and it can spread from the carrier to 6 other people. Symptoms start occurring first in the throat, such as a large white patch and pain when swallowing. This deteriorates to respiratory problems when the throat blocks up. As the exotoxin reaches the blood and lymph systems, myocarditis and neuritis will occur, which can lead to death. The disease is caused by an exotoxin of C. diphtheriae when it is lysogenized by a bacteriophage carrying the tox gene. The exotoxin is an AB toxin and enters the cell by endocytosis. Once in the cell, one of the domains halts protein synthesis, and this leads to cell death. In the womb, babies are protected as antibodies can pass to the placenta. However, between 6 and 12 months, the levels of antibodies significantly decrease. Therefore, vaccination against diphtheria must start at a very young age. Diphtheria can be diagnosed in a clinical or laboratory setting. Clinical diagnosis of diphtheria occurs when the usual symptoms are observed: sore throat, weakness, fever, or swollen glands in the neck. A laboratory diagnosis includes a PCR test, isolation from cultures, or a low antibody titer. The vaccination for diphtheria is an inactivated form of the toxoid. Some side effects can occur, such as swelling of the infection site. These effects increase in frequency and severity by booster doses in early childhood. However, no additional treatment is necessary for the side effects. The National Immunization Programme of the Netherlands, which contains the vaccine of diphtheria since 1953, is in line with the recommendations of the WHO. In the Netherlands, the vaccine DTP is given at sequential ages in childhood, and for a long life protection, a 10-year interval between a vaccination is recommended. At the moment, coverage of diphtheria is fairly high across the globe. However, it is not a good elimination or eradication candidate yet. Better surveillance of the disease in places like India and the knowledge of waning effects of immunity from the vaccine is needed.